I just don't think any of these are the right way to do it. And I was kind of challenging the norms along with my team, saying, look, surely this just increases dependency on foreign aid. None of them seem to strengthen the health system. None of them give a kind of all-inclusive solution whereby, importantly for us, it had to be local people caring for their own nation's children. So surgeons, anaesthetists, nurses, biomedical engineers, all heavily needed. And we needed to train the local people to be able to provide these services for their own nation.
Welcome to Systems Catalyst, the show that cracks the code for making the world a better place. Today, I am joined by Garreth Wood, a Scottish philanthropist and global health advocate, and one of the co-founders of Kids Operating Room. KidsOR is a charity working to make sure that children, no matter where they're born, have access to safe surgical care. Garreth and his wife, Nicola, started KidsOR in 2018. Since then, they've led the effort to design, ship, and install fully equipped pediatric operating rooms in low and middle-income countries. They work closely with local surgical teams to build sustainable systems and bring life-saving care to the kids who need it most. All right, Garreth, so I will have to say two things real quick that I had no idea about you. You have a very unique Lego collection, and you like to drive race cars. So can you tell me about this Lego collection? Because all four of my kids are desperately into Lego, and I need to know your secret.
Well, thanks, English. Yeah, this is a nice question to start with, something I know probably better than anything else. So the Lego collection is very unusual. I love building Lego.
Yes.
I find it quite therapeutic. You know, when you've got a very busy lifestyle, to be able to shut yourself off in a room and just have time to yourself where you're not really thinking about anything too in depth, but just focused on a task and completing the task. You know, often through life, we take lots of tasks we don't get to complete. So, or we fail to complete sometimes. So Lego for me is a really nice thing to just get my head into. And it's a way for me to unwind. But the collection came more from the minifigures. So my collection of minifigures is exceptionally rare. And they have, I'm not going to nerd out too much, but I have like very, very special pieces that are extremely rare. Some of them are just one or two in the world.
Wow. Some
of them are made from rare metals, and some of them were given away at fairs and all sorts of exciting Lego events. So I guess I'm kind of widely, accepted to be one of the biggest minifigure collectors, let's say. Not in terms of numbers, but in terms of the very rare pieces. So.
No, it's awesome. My eldest is very into it, Rye, my oldest child, and he has, some of the rare, like, Star Wars things that he built. And so anyway, it's a more conversation for another time. We can get into it.
I think so, yeah. But, thanks for asking.
First, we're going to talk about KidsOR. I want to know a little bit about your life before Kids Operating Room. Tell me a little bit about who you were and what your focus was before getting into KidsOR.
Yeah, so I was actually an entrepreneur. I started a hospitality company when I was 25 years old. Really, from the age of 16, I worked in the hospitality industry, right from washing glasses and pots and pans in a restaurant through to managing restaurants, bars, working in kitchens. I really got a complete transformative kind of oversight of all aspects of the hospitality industry. And then at 25, was able to acquire my first pub, or I don't know what you call a bar in the US, but we would call it a pub. So managed to get my first bar and really built up kind of hospitality business from there, and ended up opening multiple sites across Scotland, in several cities in Scotland, and multiple units that we would invest heavily in and sell them and make money. And yeah, it was a really enjoyable business because I just loved people. hospitality in Scotland is everything. People want to meet and be sociable and meet for drinks after work or for a nice meal in the evenings with partners or families. And for me, it was really, I just loved seeing people have a good time. And people can choose to go anywhere when they spend their money in a restaurant or bar, but the satisfaction that they keep coming back and support the business. And I loved it. I was very good at it. And I was very lucky to be able to sell that business, which I'm sure we'll come to later, but I sold that business for a very good reason.
Well, I think a lot of I can imagine a lot of what you find so special in hospitality is that connection with other people. And I imagine that translates a lot to what you do with KidsOR. And I'm curious to know, what are some of the personal experiences that pushed you to think about the importance of medical care for children?
Yeah, in all honesty, prior to 2010, I didn't. It wasn't really on my radar. I was very busy building a hospitality business, working extremely hard. I'd got married in 2009. But my first child was born in 2010 in December, and she was 2 months premature, Ezra. She's now a very healthy 15-year-old, causing lots of trouble and having a great time. But at the time when she was born, she was 8 weeks premature. When she was 4 days old, both her lungs collapsed. She contracted RSV, which I think as adults, we would kind of say that was a common cold. But for a very premature baby in intensive care, it was quite catastrophic. And both her lungs collapsed. She ended up on a ventilator. And I guess that was the first time, as a parent, I'd experienced the NHS here in the UK and just how remarkable it is when a child is sick. That, perhaps we take for granted that in this country, when a child is sick, they get treatment. And in fact, I had also been very ill when I was 16 with meningitis. I had meningococcal septicemia and was on life support for 2 weeks.
Wow.
And again, at that time, got the best of care. My parents went through really a horrible time with it because I was unconscious for most of it. But just going through it as a parent now, in 2010, and, we always had hope. And that was really important in our country, whereby, and the same in the US, we have really good healthcare or access to healthcare. And then children, when they're sick, are very well looked after. So the best consultants, anesthetists, everything that Ezra needed to save her life. And your question is valid because, there is a strong personal reason why we got involved. And that is because, we saw firsthand our child would not have survived. Having traveled, then gone on to travel around Africa and having been in Africa a lot prior to 2010, I just hadn't understood the inequality between what children are able to access in terms of healthcare and what we do. And essentially Ezra would have died had she been born in a low middle income country with very little access to healthcare and certainly zero access to surgery. And I would have died as well when I was 16. And then, so many of my friends and families who have children who have needed surgical interventions, even a broken leg, when there's not a surgeon, there's not a safe place to have that surgery. It was quite, I just couldn't get my head around, as I said, that inequality of access to healthcare. And I found myself in 2013 in Uganda, and I met a surgeon called John Sekabira. Now, I don't know the figures in the US, but in Scotland, we have about 3.5 million children, and we have 24 pediatric surgeons. And when I went to Uganda and met John Sekabira, now Uganda has 21 million children, and John Sekabira was the only pediatric surgeon for the entire country and could only access an operating room one half day every 2 weeks. And what was going on in Uganda was going on all over Africa. And that's why, 1.75 billion children cannot access surgery when they need it globally. And in Africa, 5 times more children die from a surgically treatable condition than HIV, malaria, and TB combined. So it was just heartbreaking to meet John. And basically what John essentially told us was that children just die waiting for surgery. And he has to make these heartbreaking decisions over who he prioritizes for surgery in a tiny window. And even then, the surgery is not that safe because he's doing it in an adult operating room with the wrong tools, sometimes the wrong anesthesia. So we made the decision to give John, my wife and I made the decision, and it was a total one-off. It wasn't to be done twice. But we agreed to fund John Sekabira and provide a basic operating room in Malago Hospital in Uganda, where John could finally operate. And that was actually Uganda's first ever. So that was in 2014. That was Uganda's first ever pediatric operating room.
Ooh,
and
wow.
Dedicated pediatric operating room. And it was transformational. Because, what we hadn't realized was that John had a trainee surgeon called Nasser. Nasser could never qualify because he couldn't get enough surgical time to sit his exams. And suddenly, within a year, Uganda had 2 pediatric operating rooms. And Nicola and I made this decision that, we'll do one more. And that was meant to be it. We did another 2 in Tanzania. And then the story began to really take off from there. But at the same time, we continued to try and have more family. And we had a number of really difficult challenges. Nicola had an ectopic pregnancy. We had triplet girls that died prematurely after they were born at about 3-4 weeks old. We just had lots of challenges as a family having children. But even through the dark times and the good times, we still always got access to the best of medical help, medical support.
Yeah.
Our children had a chance. So, Nicola's life was saved after her ectopic ruptured. So, we'd been through a lot as a family. And at the same time, in the background, as we were kind of supporting these 2 or 3 surgeons in Africa on a kind of what we call maybe a part-time basis, it came to a point where Nicola and I had to make a decision. We've seen the benefit and the impact that those first 4 operating rooms were having in Uganda and Tanzania. And really, if we were going to, I believe passionately, if we were going to do this properly, we could see that our model worked and why it was different from what other people were doing. But we just decided if we're going to do this full time, then if we're going to do it properly, we need to do it full time. Mm-hmm. And that was when we made the decision to sell the business in 2017. And that funded Kids Operating Room as it became officially named in 2018. And then really the focus on the work since then has been, 100%, it's my full-time job now, so.
Yeah. I mean, I just want to emphasize, I think it is so, thank you for sharing all that and being open about it and your personal experiences and how they really kind of led you to really think about how the inequality is so big. And I think about that all the time too. I mean, I have cystic fibrosis, I had a double lung transplant, and I think about, even the health challenges I had back in February, I was so lucky to live 15 minutes from a world-renowned hospital that I was able to go to. And I was on a ventilator. And it's just the access that, these challenges are so difficult. They're difficult for anyone. But the inequality of having access to care that can give you hope that will make you better, and then not. It's a very troubling and hard thought. And I think that that's one of the things that's incentivized me so much to get involved in global health. And what I'm hearing has incentivized you and Nicola and really the impetus of starting KidsOR. So
yeah. And even something as simple, imagine, your listeners, the trauma, if you're a parent and your child breaks their leg just riding a bicycle, which kids do, fall out of trees, ride bicycles, get up to mischief and injure themselves. I just can't imagine living in a country whereby you can't do anything about it.
Totally. Well, and I want to talk a little bit so you mentioned too, it's okay, your intention initially was okay, we'll do this one operating room. Now we'll do the second operating room. And then there was a tipping point and you sort of made the decision, we're going to go all in on this. And what I'm so fascinated by is the timeline of that happening in 2018. and you're all in and you scaled so quickly. Tell me about how you scaled so quickly, and then tell me about the time after, like the elephant in the room is COVID. And I'm really curious to know how you went from founding to scaling so quickly. And then how did COVID affect that scaling?
Well, in early 2018, I ended up in Vellore in India at a conference called the Global Initiative of Children's Surgery. And we'd done these 4 operating rooms. Honestly, English, I went out there thinking, they'd asked if I would speak about the operating rooms. And I went out there thinking, I'm going to go meet all these people building operating rooms. And we're going to be like this small organization that no one's heard of. And when we got out there, there was a real buzz about us being there. And I was like, this is weird. And I came back from that conference, 40 hours later. And I came home, I said to Nicola, we are like the only organization in the world currently focused on building surgical infrastructure for children.
Wow.
And I said, this is really, as an entrepreneur, I was like, this is really exciting because like scaling up an organization or a business and being first to market, like we almost had like the pilots that we'd done proved that, the impact was really, really transformative when you gave a surgeon a local surgeon the space and tools to do the job.
Yeah.
And I also came back going, I was just so pumped when I came back because I went, the first to market thing was really important for me because I was like, I can really monetize this. And then I was also looking heavily at what was being done by other organizations. So when you looked at, I won't name and shame organizations or whether I agree with them or not, but it seemed to be that the different options in global health around this area of providing surgery was we either send equipment or we send money for hospitals to buy equipment, or we send a surgeon from a high-income country into, let's say, Uganda, for example. We send a surgeon in from Uganda who works for 3-4 weeks and then leaves, or we bring in an entire mission-based camp or a ship that's filled with doctors and we land on the coastline and we operate and then we leave. And I was like, I just don't think any of these are the right way to do it. And I was kind of challenging the norms by saying, along with my team, saying, look, surely this just increases dependency on foreign aid. And none of them seem to strengthen the health system. None of them give a kind of all-inclusive solution whereby, importantly for us, it had to be local people caring for their own nation's children. So surgeons, anesthetists, nurses, biomedical engineers, all heavily needed. And we needed to train the local people to be able to provide these services for their own nation. And it was also really important for us that we were able to provide state-of-the-art equipment to support that. And really importantly, make sure that doesn't break after we leave. So we realized that we had to very quickly realize we were going to have to not just build operating rooms, but we were going to have to train people. And we were convinced our model was better than everyone else's. And, maybe that's not the right way to think, but I was convinced that everyone else was doing it the wrong way, and I was going to do it the right way. A very, very cocky entrepreneur who was like, I've got a solution. But most importantly for us, we were never going to sit there and tell people what they need. So it felt like the key component that was missing was it felt like, other than strengthening the workforce and strengthening the health system, it just felt like so many other NGOs would go into these countries and just tell them what they need. Mm-hmm. And just build something without properly asking questions that were kind of respectful of the local medical community and say, right, what can we do to support your health system? Or in terms of a surgical health system, how can we build a surgical health system in your country that works? Mm-hmm. Because we know not just one's not going to be enough. So when we go into a country, we know that it's going to be multiple sites that give maximum impact in terms of access and travel time to these operating rooms. So for us, building up really important relationships with ministries of health, working with them to build their surgical plans, that they write, not us telling them what they need. And then coming in the side door and saying, right, okay, we're here to support. We then obviously speak to donors, and we eventually come up with a system that is, state-of-the-art operating rooms. Some of them are, these are not this is not secondhand equipment. These are incredible health facilities that we would have in any US, UK hospital. We've got highly trained, state-of-the-art surgeons and anesthetists and biomeds supporting the equipment and the infrastructure. And when we leave, we have strengthened the health system. We strengthened the workforce, and it's completely sustainable. And as I said, it doesn't create this constant dependency on foreign aid or people coming in to help and support.
So tell me a little bit too, Garreth, about what does that look like for you and your team and the work that you do? Is it communicating with governments? Is it communicating with the local communities? Is it communicating with the training facilities? Is it all of the above? Like, how are you coordinating that effort to really take out kind of the middle layer and work on the ground with who's on the ground?
Well, if you take a country like Burundi, for example, Burundi is one of the poorest countries in Africa, in sub-Saharan Africa. It's never had a pediatric surgeon. It has no training hospital. So training a surgeon in Burundi is not an option. Now, we would never want to send them to the US or the UK to train. So we've come up with a solution for that. But 5 years ago, it was identified that Burundi was really, really struggling with no pediatric surgical service, not even a plan. So what we did was we sat down with the ministry and we said, look, we want to support a pediatric health service in your country. We identified 2 surgeons who came forward and wanted to be pediatric surgeons. We understood the limitations of training them in Burundi. So we worked with, in Malawi, they were sent to Malawi for a 5-year scholarship to train.
Wow.
with their families. So they made a full committed move to Malawi where they both trained. And actually just in November last year, we built the operating rooms 2 operating rooms in Burundi. Both surgeons moved back with their families to Burundi, now have world-class facilities. And throughout that whole process, we are working with not just the government in terms of saying, right, their surgical, reminding them that, okay, these surgeons are in Malawi, but they are coming back. But we're also able to build the operating rooms. We're working with working with the Minister of Health the entire time and the directors of hospitals to make sure that the operating rooms are being built and facilitated. And they moved back, and really that was so when we were then in November, that was Burundi's first launched surgical service for pediatric surgery, and they had never existed in the country before.
That's awesome.
So the scholarships are incredible. I mean, we pay the scholarships for the scholars while they're training. There's 2 incredible surgical colleges in Africa. One is WACS, West African College of Surgeons, and then there's KidsOR in the College of Central, Eastern, Southern Africa College of Surgeons. So,
wow.
That's where all the training is, coordinated. And these surgeons are trained to the same standards as in the UK.
You started in Uganda, but the scale, it seems like it's very, you have to adapt to what country you're going to, especially with what you're saying is working with people on the ground, working with governments, working with the specific surgeons that are or are not, there's just there's so many variables. You have a lot of variables to contend with country per country. So how do you adapt, for example, from going from a country like Uganda to going to a country like Burundi? It seems like their needs are different, and you took time to learn those needs. Mm-hmm. But what is the process of kind of really being able to adapt and be flexible?
Well, I think we're in Africa, it's almost easier because of the 126 operating rooms we've built to date. And about 80% of them are in Africa. So we're incredibly trusted partner. And our model, as I said earlier, was not to just build one in a country and leave. It was very much how do we support the entire surgical infrastructure for that company in that country for pediatric surgery. But then we move on to more challenging countries, you could say, like Afghanistan. So to answer your question, that was a very, very different proposal in the sense that after the US-UK forces very suddenly pulled out of Afghanistan a few years ago, so did the pediatric operating rooms that were based in the camps. So we understood the challenges to going into Afghanistan were difficult, but we also realized that children in Afghanistan who were, uniquely impacted by years and years of war, needed us to be there. And every part of our kind of model of what worked before had to kind of be rewritten. And not just rewritten, but like how we approached even donors and like how they can give money to this type of project. We had to work directly with the Taliban, which in itself was very interesting. And we had to reason with people who we didn't fully understand, hadn't worked with before. I would say we have an expression in the UK, bread and butter. Like Africa was kind of our bread and butter. We felt like we knew it really well. And whether that was Senegal in West Africa or Burundi in East Southern Africa, it felt like we just knew what we were doing there. But when you're sitting at 5 a.m. on a Tuesday morning on a Zoom call with the Taliban, trying to negotiate sensitive questions around, will you prioritize boys over girls when it comes to surgery? That was really difficult. And we had many, many hours of constructive conversations with them over 6 weeks, always on a Tuesday morning at 5 a.m. We called it Taliban Tuesday. But myself and David, our CEO, we had some challenging questions and productive questions, and we got there. It also created a very unique atmosphere within our office because we had women in our office saying to us, why are we going to Afghanistan? Like, we don't agree with the way they treat women. And I don't think we should be doing this. Like, there's so many other countries that deserve what we do better than Afghanistan. And we would say, we'd understand why they felt like that, but at the same time, we've always been non-political, and we'll go wherever we feel that children will benefit from us being there. And we explained to that, like we also reminded them that we work in other countries where we don't agree with how they treat certain types of individuals. Uganda, Senegal both have very, very strict rules around homosexuality, yet we're still there because children need us. And we've always said we're non-political. So not just getting the Taliban on side, but actually getting our staff on side as to why we need to be there. And then obviously the challenges of getting an operating room into Afghanistan, not having any staff there, not having our teams there in terms of our biomedical engineers, our art people, all our operating rooms are finished in beautiful artwork. Even the type of artwork we could use, weren't allowed, the Muslim faith in Afghanistan meant we couldn't use animals or live animals on our walls. So we had to redesign our artwork. It was fundamentally a different project in many ways, but it still came down to, a bit like the pubs back in my early days, it still came back to building relationships with people. And whether that's the Taliban or, we've been in some of the most remote areas of Africa and in the Amazon, meeting some of the tribes in the Amazon when we did Peru and Ecuador. You still have to build relationships with people. You still have to understand and get them to understand why we should be there to support. Getting the Taliban support was essential. And once that was given to us, we went in and built 2 operating rooms in Ataturk Hospital in Kabul. I was in Kabul once the hospitals were built, I was in there and again meeting with the Taliban to negotiate whether we would do more work with them. But it was just a fascinating project in terms of just everything that we'd written in terms of the playbook for KidsOR, how we understood things to happen, just had to slightly be reinvented. But as I said, it always comes back to relationships, whether that be with a health minister in Africa or a president or the Taliban or working in Ukraine. It's all about building relationships with people.
I think that this is a really perfect story for, a true example of how systems change works. And what I'm hearing is adaptability. I'm hearing flexibility. I'm also hearing a lot of patience, working internally and externally to try to move towards an agreed upon goal. And then I think coming back to relationships. And I'm curious to know what you would say to other systems catalysts about what it takes from you as a catalyst, as an entrepreneur, what it takes from you to build those relationships. What do you think is so important in that effort? How do you do it?
Well, I think we have a brilliant team of people, and I am the founder, and I'm very involved in the running of the business. But when we started the organization, it was absolutely key. I always say to people, my job as chairman is two things: is to make sure we don't run out of money, and also to pick really good people. And I think what we've done really well, from our CEO David Cunningham and those few key people at the start of Kids Operating almost 8.5 years ago, was very, very focused on those that have got kind of good charitable background, but also from the private sector. So those that have run commercial businesses that understand the challenges of scaling up quickly, of getting stuff done. And these people are all brilliant, and they have gone on to build essentially the relationships that most of what we do is formed upon. Whether that be, I accept now that a large part of my role is kind of, we could call it donor management, whereby, I'm very involved in the fundraising element and having key relationships with people who fund the work that we do, generous people who fund the work we do. But then all the other people from our biomedical engineer, Courtney, who's out in the field all the time from the UK, running a small Africa team, who, she's the front face, she's just as important to them as I am.
Yeah.
And she's more front-facing than I am, you could say. She's the one that, if there's a lasting impression or relationship to be built upon about if people trust what we do and how we do it, it's often the people on the front line who are creating these relationships. So we have to trust people and pick good people that we know represent us really well, represent our values really well, and also who people like and trust. And when you get to it was fine in the first couple of years when it was just 4 or 5 of us, but we're now up to kind of 40, 45 people that work at Kids Operating Room.
Wow.
And we now just have to allow a lot of that relationship building, a lot of that trust, a lot of the strategy that's set out when we go into a new country. These guys have it. Like, I'm not at that level now. I've kind of, when they've got it, and you just let them go and get on with it. And I feel that allows us to be more flexible, allows us to penetrate further. And as I said, we're now in over 40 countries around the world. So it's, you just can't do everything yourself. Yeah.
No, I think that's a really good piece of advice for other catalysts and other entrepreneurs, is like, you really have to trust your team. And yeah, I when I was running my company, I had one of my advisors say to me at one point, it was like the job of a leader, of a CEO or a chairperson, like the job of a leader is to basically find good engines, find good people that are engines, and then point them at things, and then take your hands off. And I think that remains true of any organization.
Completely agree. I was going to say, we never talked about COVID. You asked about COVID.
I know. I was going to circle back to that.
I answered the question, but I never actually spoke about COVID. So we must circle back to that. Yeah.
No, let's go ahead and circle back to it. I think that I would love to know how KidsOR fared during COVID, especially because it was kind of just launched, and then you were hit with, we were all hit with this pandemic. So how did that work?
No, I remember in February 2020, or was it early March in 2020? And we were just really hitting the ground running, employing people. And suddenly COVID hit. And I think we had a few days of, what's happened, and, how are we going to get past this? And, but like any good organization that can pivot when disaster strikes if needed, we did. And actually what was really interesting with our model was, I spoke earlier about that kind of mission model around sending surgeons to, from the UK to go and operate in these mission style camps. Because our model was around supporting local people and building systems within local hospitals, it meant that our operating rooms continued working throughout COVID.
Wow. And
actually, we were installing an operating room every 12 days during COVID. It was our busiest time because
that's insane.
We had donors giving us money because we could deliver operating rooms that they couldn't, or health infrastructure that they couldn't. Because our teams were on the ground in Africa already, they were able to travel internally, and they were able to do installations. They were able to do we'd never had people install our artwork before. We'd always done it ourselves. And we were like, there's some brilliant artists in Africa that can do the art on the walls. Why are we not utilizing that? So we just completely pivoted within 3 weeks to, this is just kind of forced our agenda, which was everything we do should be done locally. So it kind of forced our agenda, probably fast forwarded a couple of years from us really saying it to doing it. We believed it was the right thing to do in 2018, but we were still sending our teams out to do installations and still sending our biomedical engineers. But we were like, why are we not taking on a biomedical engineer in Africa that can do this work for us? And it really worked. And actually, there were organizations that just were grounded, couldn't work, were told they couldn't travel. And okay, I couldn't travel, David couldn't travel, Nicola couldn't travel, but our teams were already there in the country. So shipping lanes were open. So we could still ship equipment. We could still procure equipment and ship equipment. And we were essential workers in Dundee, so we were allowed to work through the COVID pandemic. But, as we packed operating rooms and shipped them out, it was incredible.
What an amazing feeling to be able to do that and persevere and help through the pandemic when so many others were, for, better, for worse. It was paralyzing. It was, felt hopeless a lot, I think. So it must have been really wonderful to be able to continue the work. And, Garreth, I want to point out something that I also think is worth noting about KidsOR. And you've mentioned it a few times, but the artwork on the walls, I just want to say that, I think that there's a lot of people that might pass that off as something luxury or frivolous or not necessary in a space like that. But, when I was a child going to the hospital, one of the things that I remember so vividly in my mind is that there was artwork on the walls and there was artwork on the ceiling, because as a child, when you're on an operating room, you're laying and you're looking at the ceiling, and it was these beautiful flowers and butterflies. And I just think it's so important, especially when you're thinking about kids, to make spaces feel safe and to make spaces feel okay. And I just want to applaud that effort of bringing in artwork into the operating room, because as someone who's benefited from that, I know how important it is.
Yeah. And, it has kind of multiple use. That we initially did it for that exact reason, for the children to feel like it's a warm and loving space for children to be in. But actually, it's had a much more profound impact than just that. We I've seen the doctors themselves feel really joyous using it. We know that there's always a concern around, once we build a state-of-the-art operating room, that other surgeons in a hospital who maybe don't have the same equipment might want to come and borrow it or try and use it. So it really marks the space as a pediatric operating room, and hopefully it is very effective at keeping other people away that shouldn't be using it.
Oh.
But also culturally, I remember in this country, when a child is needing surgery, more often than not, they'll be in a separate room with their parents, and they're anesthetized with their parents, and it's very calm. The sad reality, and it's not sad, it's just done differently. But the reality that we saw when we started traveling around Africa was that children are taken from their parents awake and then anesthetized on the table. And that's done for time and lots of reasons, but mainly for time, and there's not enough anesthetists. So, it's very much that as on the go, they're ready to be operated on, they get anesthetized. And that, you can imagine like getting taken from your parents, taken on a gurney to a table and anesthetized by someone wearing a mask. It's terrifying. So we try really, really hard to genuinely make the spaces feel as warm and friendly as we possibly can. And so the artwork has lots of great reasons why it's there. But essentially, it's done for the children, but also it has other impacts. We never anticipated, but the staff that work in them constantly say, like, it's just such a joyous place to work and come into. That's always important.
That's really important. No, I think that's huge. And I think it's phenomenal what you're doing. And I want to talk a little bit about, you in particular have a very unique perspective, because not only are you an entrepreneur, you're a systems catalyst, you're a nonprofit leader, but you're also a donor. You and Nicola were the donors that started KidsOR. I want to know what you might tell other donors looking to fund systems change work and to fund systems catalysts who are, again, operating in ambiguity, maybe not able to provide every bit of information to a donor at every moment of every day because the situations change. And I want to know what your opinion is on how we might get other donors involved in funding systems change work and funding systems catalyst.
Yeah, so if I could split that into two parts. The first is, I think from a KidsOR perspective, trying to attract donors or any other organization that's trying, it's so competitive now, and especially US has seen huge cuts to global health and global funding. So the competition for money as an organization is severe. And I'm a big advocate for data. Yeah. So we are actually independently, so all the data we collect goes to the UCSF in California and to the Global Health Equity team. And they're free to pick whatever they want from our data, and they're able to test it and write papers, peer-reviewed, published papers, and do everything else. And I think having that data has been key from us from the day one. So looking at like, what is the economic impact of investing in surgery, our DALYs, the cost per surgery, all these things are very key. And having a good comms team with a compelling story, I think, makes an organization who's looking for donor income, makes your life a lot easier. Mm-hmm. But I can't emphasize how important data is. And then, as a donor, Nicola and I continue to give £1 million a year to Kids Operating Room. And that covers a lot of our running costs. So it means that when we sit down with donors, we're able to talk about that balance of, what their money is paying for, and what it's going towards. I think as a donor, for me, it was the attraction of what we were doing with KidsOR was really, what's the return on my investment? As an ex-entrepreneur, businessman who's turned into a philanthropist, perhaps, and none of these titles sit that easily with me, but if I'm going to now be called a philanthropist, then I get to choose where I give my money to. And as does anyone, anyone who's donating, whether it's a small amount or large amount, part of the pleasure of giving and that joy. I often talk about the joy of giving as a donor. I do get profound joy from giving. And therefore, for me as a donor, I need to find something that I'm passionate about, that I can see real change can occur from what I'm doing with that money. And, as I said, that return on investment has been absolutely key. So I know that's not from a monetary point of view, but being able to see the end user, being able to see the impact it's having on society, being able to see the impact it's having on communities. And the joy of what we do with KidsOR is that it's not just the child. We do over 250,000 surgeries a year in children. Half of them are immediately life-saving. So I go back to what Nicola and I went through when we look at how we fund and what we donate to. It's not just the child that you're transforming their lives. It's the families, it's the entire community. It's the economic, and then you get into what is the economic impact on a country when a child is safe or free from a disability versus a child with a disability, or a child who goes to school because they can go to school having had a surgical procedure rather than not being able to go to school. All these things have come into how we've decided how we fund and what we fund. So as donors, we don't want to come and suddenly tell you what to do with this money. So, unrestricted funding, multi-year unrestricted funding, which is music to the ears of most organizations in the world, but it just shows great faith and trust in the organization you're supporting. And there are so many organizations that make it so tricky and so difficult and challenging to receive money from. And I would always say there's a balance somewhere in the middle that just says, by all means, it's your money, so you can have some say in how it's spent, but also have faith in the people that you're donating it to, that they'll live up to their side of it and spend it wisely.
So, Garreth, I know we're almost at time here, and to close, the way we like to close on the podcast is asking you if there's a question or a thought that you want to leave our listeners with to reflect on.
The joy of giving, and I talked about the joy of giving. I often talk about, and you don't need to be as elaborate as traveling to Africa and going and visit hospitals, and it can even be in your local communities. But I always think philanthropy is about, touching, feeling, smelling. And what I mean by that is experiencing the end user, the person who benefits from anything, any type of philanthropy you do, any type of giving. I would always encourage listeners to think about, if you get the chance to fund something, go and see how your money is being spent. Go and see the impact it's having. Go and see the people who are benefiting directly from your intervention. And that whole touch, feel, smell philanthropy, get out there and just do it. I've always been very, very passionate myself about that's key to whenever I donate money to anything. I want to see the impact and just get my hands dirty and get into it.
I think that's so much part of the joy of it, right? It's the humanity, it's the shared humanity that we all exist within. Thank you so much, Garreth. What a great way to start off season 5. I just have had the best time talking to you. I always do. But this is really special. So thank you for coming on.
Thank you so much for having me.